My guest today is Dr. Arthur Caplan. He's the director of the Division of Medical Ethics at NYU Langone Medical Center. Really a pleasure to have you on, Dr. Caplan. I've been reading your stuff for, certainly since I was a teenager, I would say. So it's really a pleasure to have you on.
It's frightening.
You recently wrote an article about Ebola, and of course you've been seeing the media coverage around Ebola, some of it relatively sober, some of it bordering more on fear-mongering. Certainly you've seen the xenophobia that has developed, fears of Ebola coming across the U.S.-Mexico border. And correct me if I'm wrong, but generally you're saying for Americans, the fear is overblown.
Absolutely overblown. When Donald Trump says, why are we letting people come back from Africa known to have Ebola and treating them at Emory University, he doesn't know what he's talking about. Even if people did have Ebola in Central America, which they don't, there's been no reported cases anywhere in that part of the world, they wouldn't be strong enough to make it through Mexico to get into this country. They'd die, and even if we had them, we'd isolate and quarantine them. Ebola got out of control in Africa because the world was slow to respond and get resources into very poor rural places. But while it is contagious, it's blood-to-blood contact, bodily fluids. You don't get it by sneezing. You're not going to get it by sitting next to somebody on a airplane or a train. So this kind of panic and fear that it's going to come to our homes and leave us all dead by Labor Day is just completely media hype.
Well, from the point of view of what's ethical, right, which I think is always an interesting question, we hear from some of these individuals that it is immoral or unethical to allow anybody with a case to be treated in the U.S. Could the argument not be made that what's immoral and unethical is that all of these individuals with resources have been ignoring Ebola for so long when they could have been doing more to prevent the outbreak in Africa in the first place, if we really want to talk about morality?
You can make that argument. I would make that argument, and I'd make it in two ways. We've known about Ebola. It's not a new disease. It breaks out periodically, probably jumps from infected animals to people when they eat the animals or skin the animals, get in contact with infected animals. Probably every 5 or 6 years in some place in Western Africa, we've seen an outbreak. No pharmaceutical company, no biotech company, no one has really put any money into developing either a treatment or a vaccine. Why? Because it's taking place in very poor places. There's not a big market for it. In fact, the only reason we have anything in the way of medicines is because national security, homeland security here in the United States and in some other countries tried to develop some drugs in case of bioterror. So morally, we haven't paid attention to the disease because it's not affected us, it's affecting others. The other argument about, what are we doing about Ebola is when it broke out in rural Guinea, in a very remote part of the world, nobody cared. So the reason this epidemic this time has gotten out of control is no one responded to help from around the developed world to give them the moon suits and the goggles and the face shields and the gloves and to teach them how to deal with dead bodies. We just let it go, and that's why it's gotten bigger this time.
Yeah, and what you're saying can be actually verified empirically when we look at we started covering, for our program sources, we look at several Africa news outlets, right? So we started coverage on this when it was as limited as what you're describing. Mm-hmm. And we now, in preparation for this interview with you, I went back and looked at search frequency online for Ebola. And what you see is that during the early period where it was already an outbreak, but it looked like maybe it would be contained to Africa, there was just very little worldwide interest in the matter. And when it spiked was when we heard, oh, someone may have been at Heathrow Airport, I believe it was, or whatever the case may be. Once it became an in my backyard possibility is when people started to care. But the real way to deal with this is to get involved far earlier, is it not?
It is. The way to deal with epidemic contagious diseases, whether they take place in the U.S. or whether they take place in Africa, is to get there quickly, figure out the cause of transmission, how it's communicated from person to person, and then take steps to shut it down. There's been a lot of arguing. I've been asked about it frequently. Who should get the experimental treatments that are around for Ebola. Well, the amount of treatment, a drug that's around for Ebola could fit into one water bottle. There isn't any. I mean, there's a little bit, and we can argue about who should get it. What hasn't really been addressed is, why is it that we can't get resources, boots on the ground, doctors, nurses, healthcare workers, equipment much more quickly when we get an outbreak of Ebola or Lassa fever or many other diseases and plagues that kill a lot of folks far away? That's the rationing question. Why are we worrying so much about who's going to get the rare drug when we have this huge 900-pound gorilla ethics question in front of us? What are we doing to stop epidemics in their tracks?
Okay, so that question really gets us into the next thing I want to ask you about, because the answer there comes through an analysis of the current healthcare system that we have. What's your general analysis of the ethics and morality of the for-profit, employer-connected system that is not the status quo in just about every other country at our level of development, but is in the United States? Is that a fundamentally ethical system?
It's fundamentally unethical for a number of reasons. First, having a market approach to distributing healthcare doesn't make much sense because the consumer doesn't have the information to go shopping. What do you really know about your doctor's track record? What do you really know about the person who's your surgeon or the nurse who's going to take care of you in terms of their quality, in terms of their performance? Nothing. You're buying reputation. It's also the case that in a market system, the providers can generate demand. If I said to you, you need a CAT scan, what, are you going to argue with me? You're going to lie down. So market approaches have failed dismally in the U.S. We keep hearing people saying we got to go back to them and try them again. And even Obama reform didn't really break us from that system.
No.
Then getting insurance through your employer is crazy. I favor just giving everybody the opportunity to buy insurance out of pocket or through a voucher or through a subsidy or whatever, but get the employer out of stop using them as the middleman. You get problems like Hobby Lobby, where the boss says, oh, what you want isn't consistent with my values. You get problems with industry saying, we got to buy cheap because it's too expensive for us to carry these costs. We can't compete against the rest of the world.
And don't we also get a broader societal problem where if someone is keeping a job merely to retain their health coverage, they're not going to be as productive as if they were happy in a job. They're not going to pursue what really is their calling.
Absolutely. And to be blunt, it's a historical accident that we are linking health insurance to employment, partly out of the value that you had to earn your health insurance. It wasn't a right, and I think healthcare is a right. And it's partly just an accident of unions using it to get members, some employers trying to get workers to come to them because they had better health benefits. But it is a ridiculously inefficient, immoral way to give out health insurance. It ought to just be something that everybody gets because they pay out of their taxes, or they get a subsidy if they can't do it. The overhead costs of running it through your employer are enormous. In other words, we pay overhead for all this. Think of all the people working in HR at your job who are trying to figure out health insurance issues. What does that have to do with making widgets?
Yeah, no question about it. We've been speaking with Dr. Arthur Caplan. He is director of the Division of Medical Ethics at NYU Langone Medical Center. Thanks so much for joining us.
My pleasure.